Welcome to Channel 17, the Town of Colonie Government Channel.
Hello, and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Aimee Pachucki and DiCaprio from the Cancer Services Program Partnership of Albany County. Welcome to the show, ladies.
Thank you.
Aimee, do you want to start talking about the program?
Sure. The Cancer Services Program Partnership is a state and federally funded program that has been in existence since 1994. It was piloted here in Albany County first. There is a partnership in every county in the state of New York, across the state, as well as in every state in the country. It's just known as a different name throughout the states. Every state has different funding source, and therefore they're funded differently. And Avon may hold the grant in one state. The departments of health may hold the grant in other states. So it depends on where you live. But here in Albany County, we've been around since 1994. We provide free breast, cervical, and colorectal screening to men and women. It's a great program. We're looking for some wonderful people to join our program and engage in our services.
Now, just to be clear, you used to be under other names,
yes,
such as?
Most recently, we were known as the Healthy Women Partnership of Albany County, or the Albany County Healthy Women Partnership. Some people may also know us as the Healthy Living Partnership of Albany County.
Okay.
But because we just recently started a new grant cycle, the state has asked that all the partnerships across the state be under one name specific to the county. So it is now the Cancer Services Program Partnership of Albany County, or the CSP of Albany County.
And just to be clear about one thing, our program is for the uninsured or underinsured population.
Okay. And just a few other general criteria for eligibility. Do you want to talk about that?
Sure. It is for uninsured or underinsured, meaning if the person, male or female, has insurance, but the insurance does not cover the screening, we will cover those screenings for them. If a person has Medicare A, which covers hospitalization only, then we would cover the screenings, the breast, the cervical, the colorectal screenings that the Medicare does not cover. Also, if people have insurance with a high deductible but cannot afford the deductible, then we can also get them through our program. Basically, the main criteria is to either not have insurance at all, or an insurance that only covers a partial screening.
Okay. All right. And do you want to talk about statistics for cancer in Albany County?
Sure. In Albany County, across the county alone, female breast cancer accounts for 14.4% of all cancers in Albany County. For prostate cancer, 14.6% of all cancer cases are that of prostate cancer, and 12.4% of all colorectal cancer cases in Albany County. That's what we have here. As in the program itself, across the state of New York, we've been able to diagnose over 3,000 cases of breast cancer and 85 cases of cervical cancer across New York State.
Okay, let's talk about the introduction to what screenings you cover.
Okay.
Do you want to start with that?
Sure. We cover, like we said, breast and cervical and colorectal screening. For breast cancer screenings, that means a clinical breast exam, which is the manual examination of the breast done in a provider's office. And then we also cover mammography. If a person has a need for a follow-up based on a palpable mass on a clinical breast exam or a mass seen on a mammogram, then we also cover the follow-up for that. So that could be a diagnostic mammogram, an ultrasound. If a patient needs to go on for a surgical consult, we also cover the cost of that, and any surgery that would be covered under the surgical consult.
Okay, is there an age range
Yes.
for who's eligible for the screening?
Absolutely. For the breast cancer screening, it's 18 years of age and older. The 18-year-old person would get the clinical breast exam. For 40 and older, they would receive the mammogram, unless there's a family history. If there's a family history, then we also screen those ladies based on the age of the person, the first-degree relative that had had breast cancer prior to them. For cervical cancer, the age requirement, again, is 18 years of age and older. We can screen for a pelvic exam and a pap smear. That's included in the screening, free of charge. They also get the office visit. A lot of providers charge the patients an office visit fee separate from the pap smear and the pelvic exam. So we cover that as well.
Okay. Do you want to just generally define what a pap smear is?
Pap smear is when they take a sample of the cervix looking for cervical cancer. And nowadays they're using more what they call a liquid-based pap smear as compared to the conventional pap smear. Liquid-based being a liquid-based pap smear where they're not sliding anything on a slide and sending it off to a lab. And we also can cover the Gardasil vaccine in our program for women 19 to 26 years of age. And the Gardasil is the vaccine, that cervical cancer vaccine that protects against 4 types of the HPV or the human papillomavirus. And those 4 types, 2 of those 4 account for more than 70% of all cervical cancer cases. So that's another bonus that our program provides.
And you were saying something interesting about cervical cancer to me, which was about the diagnosis and how it's diagnosed more frequently. Do you want to just mention that real quick?
Right. There aren't too many statistics on cervical cancer incidence in Albany County specifically, like there were with the breast, the prostate, and the colorectal. That is because it is caught much quicker than the other cancers. Having a pap smear and having women go for a pap smear regularly catches a problem before it happens. More than likely, if there's an abnormality in a pap smear, it's a pre-cervical cancerous condition or lesion. In New York State, we have diagnosed almost 6,000 pre-cervical cancerous lesions across the state, and therefore it doesn't ever get to cervical cancer. Only 85 cases of cervical cancer have been diagnosed through our partnership since 1994. So that means people are going and getting the screenings and they're taking care of themselves before a cervical cancer diagnosis happens.
Okay, Kathy, colorectal cancer screening. You want to talk about that?
Sure. We screen men and women over the age of 50 for colorectal cancer. And how we do that, and the guidelines are the same as Aimee mentioned before. If they meet all the other guidelines for our program, except the age 50 and over, that is all the same. If they have a first-degree relative that had colorectal cancer and they're at high risk or at increased risk, we send them on for a colonoscopy. Otherwise, all of our average risk screenings are done through an Ensure Fit kit. That's the kit we've chosen in our county to use. We've done a lot of research on the kits, and the old FOBT kits you probably have heard of before, and they used a 3-sample screening with a little stick that you used to have to get the stool and put it on a card. This is so much easier. Through the pilot program that we studied, this kit, or immunochemical kits in general, increased participation by the patient by 66% because of its ease of use. And I'd like to show you that, if I could. With the old kit, as I said, it was a 3-sample kit. You had to wait 3 different days. This kit is only 2 samples. Comes with this little card, little sample here. And it comes with its own bags and paintbrushes. The paintbrushes seem to be the thing that most of the patients like over the old stick method. All they have to do is wipe 5 seconds on the stool and then 5 seconds on the card, and it doesn't even need to show any color. It will pick up human hemoglobin. The reason that
That's blood, right?
Yes, human is the blood. And the reason we are going to an immunochemical kit is because it only picks up human hemoglobin. The FOBT kits, you used to have to be on a special diet. You couldn't eat meat 2 or 3 days before you did the kit.
Because the blood from the meat would be picked up.
Correct.
Right? Okay.
All right. And it also interfered with medications, or the medications interfered with the test. So you would have to be off of all medications, and that is, not a good thing for some people. So the immunochemical kit only picks up the human hemoglobin. You don't have to be on a special diet. You can take all of your medications during the test. So it really has been made much simpler for the patient to use. And as I said, it's only 2 samples rather than 3. It comes with another brush, so you can do your second sample.
So you do 2 days of samples. You
Yep.
put them on the card, and
Yep.
what happens after that?
All right, you put them on the card, and you have the date you took the sample on one of these tear-offs, and you just stick that, and they even have the little dotted line here where you put your label. And you take this, and you put it in an envelope, and you tear off. This is your demographics that you've put on here, your name, address. You put that in the envelope, and it's all postage paid. Drop it in any mailbox, and it goes right to Quest, and they process the kit for us. And then we get the results. We have the results sent to a primary care physician, and the results come to us electronically. If we don't get results in a couple of weeks, then we can get a phone. We can call the patient and follow our kits and ask them if there are any questions about the kit, if they had difficulty using the kit. Some people have a language barrier, and we don't find that out until we actually get them on the telephone, and we can get someone to help them do the kit and send it in.
And they should do that how often?
The colorectal screening should be done every year. So if people are uninsured, or if they have insurance that does not cover colorectal screening every year, we will pay for the off year also, even if they have it paid for now and then. And in Albany County right now, this has increased participation so much. In Albany County, our kit return rate is up to 73%. Which is it was a great return rate.
Do you want to talk about your partnership with Price Chopper?
Yes, we have partnered with Price Chopper. As I said before, if we have a patient that has increased risk or high risk, if they have a first-degree relative that had colorectal cancer, or if they've had polyps themselves, and I can show you what those look like.
This way.
This shows a normal colon here. And this is a polyp. And if you have a colonoscopy, which is what happens with our increased or high-risk patients, or a person that has symptoms, or if we get a positive kit, InsureFit kit back, if you have a polyp, they can get that polyp out. And that's most of the time what causes the cancer. So if you get the polyp out, you've gotten the cancer. Even now, they talk about having areas on the flat side of a colon. It's not a raised polyp. They can see those in the colonoscopy. So those also can be removed during a colonoscopy, and that ensures that that spot or that polyp will not turn into cancer. So we will send those patients on for a colonoscopy, and we have many partners throughout Albany County, and we partnered with Price Chopper, and they provide us with the colorectal prep medications. So we find out when their appointment is with a gastroenterologist, and we send them a little Price Chopper card in the mail, and they take that card with their prescription from the doctor, and Price Chopper will give them their medication, and then they bill us.
So that's where they get their prep medication?
Right.
From Price Chopper?
Yeah, and it doesn't matter, every doctor has a little bit different system that they like to use, and it doesn't matter which system or which medications they use. Price Chopper gives them all of those.
Okay, now your program also does education for prostate cancer. Do you want to talk about that?
As of October 1st of 2007, we began paying for prostate cancer treatment. in all of our cancers, as Aimee said, if something is found on any of our screenings, we do pay for all of the treatment that's needed. So as far as prostate cancer is concerned, our program does educate men on getting tested over 50. If you have a first-degree relative with prostate cancer, and African Americans have a higher incidence. We don't know why yet, but there are higher incident rates in African American men. We suggest, and ACS suggests that they begin testing at 45, so a little bit earlier. And we do provide all those educational materials to people that come in, and we suggest that they have not only the PSA blood work done, but a DRE, which is a digital rectal exam. Many men will go for the blood work, but they don't want to go for a DRE.
Right.
And it just isn't safe to do that. It kind of sets the patients up for a complacency. If a PSA count comes in okay, then they think they're okay. Well, we've been finding more and more men with a PSA count between 1 and 4. It used to be that between 1 and 4, the doctors would say, okay, you're okay. You don't need to go on for any other screening. And we're finding more and more men who are falling within that 1 and 4 PSA range that do in fact have cancer. So we suggest the digital rectal exam along with it because the physician can detect a palpable mass with the DRE. We have a group of men that we meet with, a support group, at the American Cancer Society every month. It's the third Wednesday of the month. The man-to-man support group meets at the American Cancer Society. And if you ask those men to raise their hand, how many had their prostate cancer detected on PSA, you'll see maybe a few men. Most of them had their cancer detected with the DRE. So we really do suggest that both of those are done together.
And that's more of a silent cancer, right?
That's right.
You can't really, you don't know that you're sick.
You don't know that you're sick
until the doctor feels it.
Right. And they feel that palpable mass. So when we talked about the treatment for the prostate cancer, we do, as of October 1st, 2007, we are paying for that treatment also. We don't have a screening or the biopsy diagnosis, but we do pay for the treatment under our Medicaid Cancer Treatment Act again. And these men can choose any treatment that they would like. All of the cancer treatments for prostate cancer are covered, so it's their choice. They do have a choice.
Okay, Aimee, do you want to talk about what treatments are covered for breast cancer?
Yes, any treatments are that if a woman is diagnosed with breast cancer through our program, after going for their surgical consult and there's a diagnosis, then what happens is they meet with one of our case managers. We have a staff of a case management staff in Albany County, and they meet with that client and do a Medicaid application. The Medicaid application is, it's only about a 3-page application. A standard New York State Medicaid application is typically 10 to 15 pages long. Ours is only 3. And one of the 3 pages is actually completed by the physician that diagnosed the patient. So technically the patient is only responsible for 2 of those 3 pages, which our case manager meets with them to do. Then the patient can then go on and receive any treatment that is recommended by the surgeon, by the oncologist. As long as they go to a provider that accepts Medicaid, they are covered.
Is it Medicaid or Medicaid?
It's Medicaid.
Medicaid.
Yep, it is.
Not Medicare A.
Right.
No,
Okay.
Medicare A is separate.
Okay.
Medicaid, it's, we also have coverage for any woman that's diagnosed with cervical cancer. If they're diagnosed with cervical cancer, then they would also then go on to any Medicaid accepting provider for the treatments that are recommended. And as long as they are accepting Medicaid, then they're covered under our program. The other thing is if someone is diagnosed with a pre-cervical cancerous lesion, which is much more common than a cervical cancer diagnosis,
Right.
they are covered also through the Medicaid program. Basically, once a person is screened through our program for either breast, cervical, or colorectal cancer, Once there's a diagnosis, they become a Medicaid eligible client. We do the application with the case manager. That medical form that I said the physician fills out goes to the physician. The turnaround rate for our Medicaid is approximately 7 to 10 days, whereas standard New York State Medicaid is 45 to 60 days. So our turnaround is much quicker, which means the patients can get in for treatment much quicker than if they went through the New York State Medicaid program. The one thing to remember is in order to get our Medicaid program, they have to be screened through our program. So if someone was screened at a provider that does not participate with us, they are not eligible to get that Medicaid. If they are screened through a participating provider, then they are eligible for the Medicaid. So that's where it gets difficult sometimes. Yes.
Okay, and when do they have to reapply for your program?
For Medicaid. For a breast or colorectal cancer diagnosis, they would reapply or recertify annually. As long as they're in need of treatment, they are eligible for Medicaid. So if they're still in treatment 5 years down the road, then they're still eligible for the Medicaid as long as they meet the income requirements. Our income requirements are 250% above poverty level, where the standard New York State Medicaid is 150% above poverty level. So we can get in quite a few more people into our program than the New York State standard Medicaid. The coverage is exactly the same. It covers them from head to toe for the 1 full year, and then annually again as they recertify as they need it. For the cervical cancer, it's the same thing. They would be eligible as long as they're still in need of treatment. For a pre-cervical cancerous condition or diagnosis, the length of Medicaid is determined by the colposcopy or the cervical biopsy that they would have. So it could be 3 months, it could be 6 months, but they still would be covered from head to toe for that length of time.
Okay, and do you just, Kathy, do you want to talk about prostate?
The treatment. For prostate cancer, as I said, they can choose any treatment that they would like. There's a radical prostatectomy, which is the surgery. They can choose radiation therapy. They can choose the androgen deprivation, which is the hormone therapy, or expectant management, which used to be known, I think, by most people as watchful waiting. And that's the one everybody kind of says, well, then, how do I get treatment for that?
Right.
Well, while you're on watchful waiting or expectant management, as we like to call it now, you are still on some medications. You have to be tested every 3 months or 6 months, depending on what your physician wants. So you are on this Medicaid program, first signed up for a year, and then just as the other programs, you reapply. You will very definitely, as long as everything is the same, you will still get that treatment paid for.
Okay, Aimee, do you want to talk about, you've kind of talked about this, but just so people are clear, where can applicants go for treatment?
For treatment, they can go to any participating physician that accepts Medicaid. So as long as the provider is accepting Medicaid, they can go there. Normally, many of our men and women would go through New York State Oncology Hematology. They accept Medicaid, and they would go there for their treatment. They can go anywhere across the state that accepts Medicaid. So if they want to go for a second opinion somewhere in New York City, for example, as long as they accept the New York State Medicaid program, they can go there. Now, for men and women that want to come into our program for screening, they need to go to one of our participating providers. And in Albany County, we have several participating providers. Many of the area hospitals participate. So if a woman wanted to be screened for a mammogram, she has her choice of locations to go to. We have private physicians, health clinics that participate, several area health centers that participate. And as long as they go to one of those places, they are eligible for our program.
And that's why we're trying to get the word out to many of the providers. If they aren't one of our providers now, they could really help their uninsured or self-pay patients by contacting us and becoming one of our partners. Because, as we said before, if you diagnose them, or if they, through your program, through that physician's office, and you're not a provider, then we can't pay for their treatment. So, you know, it would really help every physician in the area who has these patients to give us a call and, you know, become one of our providers, and then we can help all of those patients.
Okay, so Aimee, how does a person apply for your program?
It's very simple. Usually one of two ways. Either they can call our phone number directly, which is 518-454-4000, or, and when they call that number, they would get one of our staff people.
Yep.
There's a form that we fill out. They don't have to fill out anything. We don't require any verification. We don't require any income verification. We don't require any insurance verification. We just have a few questions that we ask: basic demographic, address, phone number, if they have a primary care doctor, and their risk criteria, if they have any high risk for breast or colorectal cancer. And then we would set them up for an appointment at their provider, at the choice. They pick the provider that they want to go to. So just because they live in Guilderland, let's say, and they want to see somebody in Latham, that's their option. We do not designate a provider for them. They have a choice of a male or a female. If they would prefer a midwife, we have midwives that participate. If they would prefer a PA, we have PAs. So it's really their choice. So they can come in through that way, or they can go to their provider's office, and if their provider participates in the program, the provider would then sign them up. So the provider or the nurse or they themselves can fill out the demographic information. They will be screened, and then we pay for those services.
So just to be clear, it's not every provider that accepts Medicaid that they can go. They can just, it has to be a provider that's recognized by your program,
Yes,
correct?
that participates.
Well, that is for the screening
Screenings.
part of it. It has to be one of our providers for the screening part of it. Now, for the treatment part, that's what we were talking about, the Medicaid. They have to already accept Medicaid in order for us to sign on this patient for our special Medicaid program.
Right.
So that's just the treatment part.
Right.
Okay, so just to review, I know we've talked about a lot of stuff during this show. Do you just want to review who is eligible, the age ranges, and what they can get?
Sure. For any woman in Albany County, 18 years of age and older, they're eligible for a clinical breast exam, which is, again, the manual examination of the breast, and a pelvic exam with a pap smear at a participating provider. If a woman is 40 and older, she is eligible for a mammogram, unless there's a family history. If there's a family history, depending on the age of the first-degree relative, then we would send them on for a mammogram based on that age. For a male and a female in Albany County at 50 and older, they're eligible for the Insure Fit kit. Or if there's a high risk, again, they would go on for a colonoscopy.
And they would be, if their first-degree relative was diagnosed before the age of 60, they can be screened earlier. So I think we need to know that.
Yes.
Okay, and just the contact information again for the program.
Okay, the contact information, if anybody's interested, they can call 454-4000, area code 518.
Okay, and your location, I know you're on
We are located in the
Kimberly
American
Square, right?
Yes, by
In
Kimberly
Loudonville.
Square. We're located, our office is located in the American Cancer Society building, which is 260 Osborne Road in Loudonville, right conveniently next door to McDonald's. If anybody would like to stop in and get information about cancer or any services that the Cancer Society provides, or if they're looking for information about our program, they're more than welcome to stop into the Cancer Society office and ask for one of the partnership staff. They can also call the American Cancer Society number 1-800-ACS-2345. Or go to www.cancer.org, and they'll get a link that way through our phone number to get our phone number.
Okay, and just to review for all of our viewers, that if they know any healthcare providers that accept Medicaid that are not in the program,
Right.
they should talk to them and ask them to please participate, right?
And they don't have to accept Medicaid to screen. If they
screen, right.
to screen, they do not need to accept Medicaid. So any provider that wants to participate with our partnership, again, they'd be working with a wonderful group of physicians, private physicians, larger healthcare facilities, hospitals. They should contact us as well, 454-4000. And we're looking for all different physicians, family docs, OBGYNs, urologists, gastroenterologists, internal medicine docs, midwives, you name it, anybody that's interested in participating. We're always looking to expand our partnership so that we can screen more men and women in our program. This year, for the 2008-2009 year, we are goaled to screen over 1,000 people. So the more providers that we get on board, the more people we can screen and offer our great services to them.
Great. Thank you so much for coming, you two.
Thank you,
Thank you
Peggy.
very much.
Thanks for watching. We hope to see you next time on Focus on Health.
Welcome to Channel 17, the Town of Colonie Government Channel.